This is 26 years male patient. We are here in Pakistan. The history of this patient, he was okay up to age of 16. Then he started weakness in the lower limb. There is no Guillain-Barré syndrome and no injury from the snow. Because he's from Swat, there is no road traffic accident, no brain trauma, no encephalitis, no meningitis, and no poliomyelitis, and no steroid use, and no cocaine use. And he is unable to walk. He's a wheelchair. Where is the wheelchair? You can show me. This is 26 years. He was seen throughout Pakistan. Let's see today when we have investigated. This is just this is the wheelchair of this man. This is the wheelchair of this man. There is no spinal cord injury. This is the X-ray of this young man. This is the X-ray of this young man. Look on the bone. Look at the bone. There is just like the bone. Look at the bones. And he's unable to walk. He's the wheelchair. Any other diseases which can put because when we have tested the level of D with unrecordable in a country like Pakistan. Look at this. And they have this bundle of patient, so many papers, and look at these are about 13 MRI, and seen by different specialty doctors. Look, see, my name is Dr. Farooq. I request to all the kind people of the world which have no sunlight come to Pakistan, because we are good people. Pakistan is a very, very good country, and because we have sunlight, which is very, very safe, and Pakistan is cheap country, not so expensive like Dubai. So we are currently inviting the American and the Russian to come to Pakistan. We have tropical zone like Karachi, and upper zone May to November we have sunlight which is full of ultraviolet B rays. So that was the basic concept. When ultraviolet B rays hit the skin, the 7-hydrocholesterol converted to pre-vitamin D3. Then there is first hydroxylation in the liver, then the second one in the kidney, and then come to the small intestine. They absorb the calcium part, the bone and teeth, and also absorb the magnesium. So the magnesium deficiency lead to these issues. Because there is hernia, muscle weakness, and the cochlear nerve become weak, so there is deafness and vertigo, not dizziness. I am cardiologist. And palpitations in pubis, and whitening, and headaches, and bad smell in the mouth. Burning soul, they also decrease the flow of bile, so they lead to gallbladder stone. If not use ultraviolet B rays on the skin, there is hyperlipidemia, and there is the #1 killer in the world, heart attacks like these. And when the D's decrease, the parathyroid hormone is increased, there is increased excretions of the calcium from the renal, so they lead to renal stones. And they vitamin D remove the calcium from the bones, so there is rickets, osteomalacia, joint pains, back pains, teeth problems, short stature, and deafness, because the ossicles become soft, so there is weakness of the vestibular system. The vitamin D is very, very, very known in boosting the immune system. So the world suffering of infectious disease, which is the third cause of death in the world. So especially in Pakistan, there tuberculosis, asthma, and throat infection, and rheumatic disease. That is the concept, that is the basic philosophy. When the streptococcus come and they hit the throat, and then after 21 days they involve the mitral wall, and different allergies, and some cancer like colon, prostate, and psoriasis, and diabetes mellitus, and leprosy, and dengue. Also vitiligo, which is 1% people of the world suffering. If someone using sunlight on the skin, especially the Arab people suffering of vitiligo, which is called in Urdu, Urdu, I don't know, Pushto, Brage. Brage Urdu kise bhai? I don't know. There is some widening spot on the skin, which is called vitiligo. Which is 1% people of the world suffering. If someone exposing the skin to the sunlight, there is no vitiligo in 4 months. And some, if there is on the neck, in the hand, face, because ultraviolet B rays is very, very protective part of the neck, and A rays is protective part of the vitiligo on the limbs. Anyhow, vitamin D decrease 50% in 14 days. So when they decrease from 47, they're damaging the bone, and when they decrease from 105, their life expectancy is decreased 13.6 years. And when vitamin D is increased, we giving steroids, because the steroid remove the calcium from the bones. Also, some people using tegretol and phenobarbital, which have interaction with vitamin D. The same as I am cardiologist, linoxine and calcium channel blocker have also interaction with vitamin D. Because this is the philosophy, because in Quran there was no sunlight on Aswab Kaf, and because sunlight not recommended for the people which are sleeping or dead. They were sleeping for more than about 800 years. This is very interesting story in the Quran. And also there was a time which is called heliotherapy, and the Greece people using sunlight on the skin, then they start the worship of the sun. Okay, that is diet for us. And Quran not ban any diet. As mentioned in Surah Al-Nam, one can use all the halal diet. There is no ban of any diet. So unfortunately, the world is contaminated, our brain is contaminated, diet is contaminated, but the God is the same and sunlight is the same. So we are inviting the people which is living in the zone of the world which have very low ultraviolet B rays to come to Pakistan, and they will be enjoy, because one day Pakistan, because the equator line crossing 11 countries, in 9 of that 11 countries are Muslim countries. So Dubai is very expensive. So come to Pakistan, you will be enjoy, and we are good people. We have so many beaches, and we have so many good diet. Because if someone using sunlight, one should be use cholesterol. Because we will be not in this world, my age is 52, but for the using up vitamin D from the sunlight, one should be use cholesterol. Because that is actually the 7-hydrocholesterol which is converted to pre-vitamin D3 in the skin. That was our old culture in Pakistan when we working in the open field and we eating so many butter. There were no such diseases, that is called European diseases. Unfortunately, now we are using so many analgesics, so many different protocol. In the female when deficient of vitamin D, 95% babies are born in hospitals. So I think 84% diseases, health problems are due to not using sunlight on the skin. So my name is Dr. Farooq. My pick is this. I am cardiologist. If someone want to, okay, what is the job of the cardiologist with vitamin D? Anyone can quote me, any patient in the world which have some heart attack and they have no pain in the lower limbs on the back. That will be appreciated if someone quote me, any patient. Except those people which have some congenital problem, congenital anomalies of the coronary arteries, or some cocaine addict, they can lead to sudden heart attack. If other any obstructive arterial obstructive diseases and there is no pain in the back and the lower limb in the world, and the patient suffering of heart attack or CVA or peripheral disease or carotid, can quote me to send to me the data, because my research field is this. Safe use of sunlight in summer on skin with no diet restrictions. Okay, thank you. Any comment, because sharing is caring. Any comments should be appreciated, but one day we should be follow this table, otherwise maybe some other solution for the health problem which is induced by the human being, not from the God. Let's see with time what happened. Inshallah, maybe 10 years, 15 years, the world will be changed. Thank you, because our lifestyle is changed. We are sitting in the offices and we are sitting in the cars, and if we look at the winter, there is no sunlight, but the trees become dry. If someone look on the nursery which is flowers, that is so fresh, but look on the children which is not using sunlight, they are not looking like flowers. So why can we think at this philosophy? When why there is so many heart attacks in the winter months, not in the summer? That is not the catecholamine release and no platelet aggregation. That is totally wrong. Because that is actually pathology. Philosophy in the winter that is decreased vitamin D, so we suffering of infectious diseases and CVA and heart attacks. Thank you very much. If anyone, because I will be share this video on IVF International Orthopedic Federation osteoporosis, because I am member online of that federation. Thank you.